So chiropractors, we like to talk numbers, right? Your office visits, your this, your that, and whatever. Talk numbers a lot in chiropractic. We're going to talk some different numbers today. You ready? All right. So 2022, a little over 10% of births in the US were preterm births. Why do I want to add this? Because there's two factors in the world of neurodevelopment and neuroscience that they study the most, in neuropsych actually, that are predictors of interest for the neurobiology of disease for the rest of the life of a human being. Get that. Two predicting factors that will determine the neurobiology of disease for the rest of the life of that human being. And the two factors are low birth weight and a preterm birth. Okay, this is especially for the neuropsych world. So, over 10% of births are preterm in this country. 1 out of 6 kiddos in this country is said to have at least one neurodevelopmental delay. Okay, most of them have more than that. 1 out of 36 kiddos in this country are said to have autism. In the year 2000, that number was 1 out of 150. 2024, that number was 1 out of 59, and now we're at 1 out of 36. I'll try not to move too much because it cuts out. 1 in 10 children in this country between the ages 5 and 17 are said to have ADHD. And all of those that we just talked about can be predetermined with prenatal stress. Prenatal stress, chemical, physical, emotional. Sound familiar? Vertebral subluxations might fit into there. Is vertebral subluxation a toxic stressor on the body? Abso-freaking-lutely. All right, so in utero stress is the determining factor that will predicate these preterm birth and low birth weight. And this, my friends, is the neurobiology of a disease. So this is temperamental. Okay, two brains. Brain on the left, brain on the right, 3-year-olds. Okay, would you agree with me that the brain on the right is a healthier brain than the brain on the left is a healthier brain than the brain on the right? The brain on the left is a typically developing 3-year-old, while the brain on the right is a child that's in the 3 percentile of developmental growth. Brain is smaller, less dense of the cortical tissue, and larger ventricles. What is the difference between those two kiddos? The difference is the kiddo with the brain on the right has deprived sensory input to the brain. The brain needs to know the status of the body in order to thrive. Do you get that? Information from our environment, our external environment, but even more importantly, our intercept of our internal environment is absolutely fundamental to neuroplastic development and to prevent neurodegeneration. That means we need to move. We need to know the status of our body. Our brain needs that information in order to thrive. We need to move. That means movement from our joints, our muscles, our tendons. It means information from our internal, our viscera, our heart, our hormones. Everything that's going on inside you, every chemical reaction, that brain needs to interpret it. And in turn, it can send down signals to modify the behavior. I'm doing my master's in neuroscience right now. Those of you that know me and know who one of my best friends is probably find that surprisingly not. We'll get into that. But everything I'm studying, they talk about cognitive behavioral neuroscience. Cognitive behavioral neuroscience. Big long word, right? That's chiropractic because the way the brain perceives the information from the body is the way we behave. And in this brain, this poor little 3-year-old is not receiving proper sensory input. So now let's go to the next slide. I've been in practice 33 years, okay? I'm still 24, at least I thought I was. Anyway, Alzheimer's, let's take Alzheimer's. Okay, over 10% of the population in the US is said to have Alzheimer's, 1 in 9 adults. Okay, not okay. 38% of 38 million Americans are said to have diabetes. 1 in 5 don't even know it. What do we term Alzheimer's? It's called type 3 diabetes. That's the name for Alzheimer's, type 3 diabetes. Okay, you see the cascade of what we're doing here? Suicide rates. This is not acceptable, folks. Suicide rates rose 62% from 2007 to 2021. And look at the age group, 10 to 24-year-olds. Not okay. These are numbers we don't want to have to know. Depression. Just a little over a year ago, about almost 30% of the population, they said they report having lifelong depression, while 18% report that they had current episodes of depression. And then my favorite one, the home run hit for 2024 in mental illness. Term I don't like, mental illness, but the number one hit is GAD. Almost 20% of people in the country report GAD. You know what GAD is? You want to know? I hate this. General anxiety disorder. That's GAG, general anxiety disorder. Do you think, let's just really common concept, if the brain can't perceive what's going on with the body and it doesn't know how to respond appropriately, do you not think that this was caused some level of anxiety? Absolutely. If you want to get into the neurology of it, we can get into the neurology of it as well. But bottom line is, you get stuck in your amygdala. You get stuck in that limbic system, that emotional center. Okay? And that's a driving force. That's a driving force of so many of these days. They are not in their bodies. They are not here. They are not centered. They don't have the neurological ability to be because their prefrontal cortex, their reasoning part of their brain is flipped off. We'll get into that in a minute as well. So I told you I talk fast. Okay, after COVID, this came out in a profound article of Neuropsych said, assume that every child has PTSD unless proven otherwise. Take a minute for that statement. That is a profound statement. Every child having PTSD unless proven otherwise. Let's talk about PTSD. About 1 in 11 Americans report having PT at some time in their life. And if you look at the lifelong trajectory of adolescents with PTSD, it's 8%. Lifelong. What is PTSD? PTSD is not being able to rewire a program, some trauma that happened that your brain wired it into its brain and it can't break that circuit. All right, chronic pain. Now, chronic pain, it is defined as having pain nearly every day or every day for at least 3 months. It is defined as having pain nearly every day or every day for at least 3 months, right? High impact chronic pain is defined as having chronic pain or nearly every day or every day that impacts your life and or work. So look at where pain is. Chronic pain is with regard to hypertension, depression, and diabetes. Chronic pain is at the top. Now you're probably thinking, I thought she was going to talk about the brain. We're not pain doctors. We're brain doctors. Why is she bringing in pain? Because chronic pain without tissue pathology, without a lesion is in the brain. The brain maps the pain and it keeps it there. It becomes its norm. Now, with tissue pathology, it's a different story. However, what makes a person that has chronic pain from an injury, a true tissue pathology, what makes them, do you ever sit and think, those of you that practice, and you see what makes one person with chronic pain give up? What makes them possibly want to be one of those statistics of 62% rise in suicide? What makes them lose their job, can't get out of bed, versus the other person that there's something about that person, there's something that's happening in their brain. They have a true injury or illness that is painful, but they can overcome it. Do you ever think about that? What is their ability to adapt? Why? How can they do that? What is their ability to adapt? I know personally that chiropractic helps them adapt. And they don't have to become one of those statistics. And I'll prove it to you. Chronic pain in the brain. It's a sensory, emotional, and cognitive experience. It is an experience that people have, and it is real for them. Don't ever dismiss it, even if you don't see a tissue pathology. It is as real can be. And when I talk about pain, I'm talking about pain. I'm talking about chemical, physical, emotional, mental, not just physical pain.